Well, we're at Cedars-Sinai Medical Center, and this is Dr. Bellack, and he's one of my doctors here, ear, nose, and throat doctor, and we've been dealing with the issue of vertigo. And you know, I come to California because somehow I fell through the loops in Tennessee and couldn't get insurance, and I found a patient advocate. And my patient advocate basically led me, guided me through the system. My question is, how has the new Affordable Care Act passed by the federal government, how has it affected other patients? Are you seeing patients that have the same problems as I do? And are you seeing, has it impacted the medical industry as a whole?
I think it's been a huge problem because of the fact, as you have experienced yourself, where you sort of fall through the cracks. And I think there's a lot of people that do fall through those cracks. If people have existing insurance and they can continue that existing insurance, that's one thing. Right. But because of all of the changes that have come about, a lot of people have been forced, obviously, to change. They've got to change from one plan to another plan, a different kind of a deductible, a different kind of a copay. Right. Some doctors are covered, some hospitals are covered, some are not. Right. And so you don't know what's in network, what's out of network. You don't know what you qualify, what you don't qualify for. I think there's a lot of questions out there about what people are able to get for themselves for health care. And so, unfortunately, there's been more questions than there have been answers. And I think that your experience has been a very common one. Sure. And that there's a lot of people out there who are really looking to find an advocate to help them navigate the system. And the system is a relatively complex system, and it's a system that just recently changed, and it's continuing to change. I'll give you an example. Here at our hospital, we used to have a policy where the new Affordable Care Insurance was not covered at our hospital, but it is covered in my office. So I can see the patient in my office, for example, and prescribe medications or do whatever necessary. But as a surgeon, if the patient then were to require surgery, I would not be able to operate on them at my hospital, or it would be an out-of-network hospital. It would be a tier 2 hospital, a tier 3 hospital instead of a tier 1, and so the compensation would not be as good. So there's all kinds of problems associated with people finding coverage that is suitable for them, in keeping with what their needs are.
Do you think everyone in the medical industry, especially hospitals, do you think they even understand the Affordable Care Act?
I don't. I think that the hospitals are finding out themselves. We've asked the hospital when this initially came out as to what was going to actually be the guidelines that we had to follow, and they didn't really have guidelines for it. It was kind of like, well, we're going to try this for a while and we'll see. The initial reaction that we had here in California was to do nothing for 1 year, see how it all pans out, and then reevaluate. Well, they didn't wait an entire year. It was a little bit less than 1 year that they actually went back in and said, well, we do need to renegotiate contracts with Blue Shield, with Blue Cross, with United Health, in order to be able to service this patient population. So I think the hospitals are kind of finding their way through this whole thing the same way that patients are and doctors are.
Would you recommend a patient advocate to guide them?
I think we need more patient advocacy because, unfortunately, there's a lot of patients that are in the same boat.
Sure.
And they just don't know where to go, what is their best option, you know, and what would be the best benefit. And then they don't know if they do Plan X or Plan Y or Plan Z, you know, what doctors are covered, what hospitals are covered, what services are covered. Sure. There's all kinds of different deductibles, there's all kinds of different co-pays, there's all kinds of different plans, and I think it's really difficult for patients to be able to sort through all of that. So I think we need an explosion of advocacy people to help navigate this system because it is so complex.
Oh, I agree, because me personally, I was lost.
Yeah.
I didn't know what to do next.
Yeah.
I had exhausted all options, and I was very lucky to be guided to you. And you know, if it wasn't for Lisa at Soul Sherpa, I would have never found you.
I think there's a lot of patients that unfortunately have been in the exact, or are in the exact same boat. and that is that they know that they got to do something, they can't get coverage, or they haven't been able to get coverage, or they're not exactly sure how to go about getting coverage. And I think that's the tough part, is that people just don't really know. A lot of doctors, unfortunately, in their response to some of all of this is to pull back from coverage. Insurance coverage, and so there are doctors that I work with that traditionally always accepted Medicare. They always accepted Blue Cross and Blue Shield, that do not any longer accept any insurance, and going more to a cash kind of a system. Well, patients are not familiar with that, and certainly patients that are going for surgery or things that might be a big ticket item, are not necessarily able to pay for that out of pocket or whatever, and so it's becoming a much more complex, much more difficult system that I think patient advocacy really can help contribute to sorting a lot of that out.